morning. How may I help you? My name's Valeria. Generally, when the patients come up to the desk, we check them in for the visit. At the end of the patient visits, we check them out, which consists of scheduling follow-up appointments, sometimes some different testings as well as ultrasounds, CAT scans, PET scans, biopsy.
This is Erika. I'm actually calling from Dr. Fittis's office. How are you today? I'm a medical assistant. My role with the patients is just vitally them, making sure their blood sugars are up to date, download the meters, and get A1Cs and glucose for them. If they need any injections, we'll do that as well, and then have everything ready for the doctors. We have a nurse-ran clinic here, so our patients get to come in and see us for all types of procedures. We do ACTH stimulation tests. We also give reclass for osteoporosis. It's an intravenous infusion. We do a lot of Prolia injections here. We also give Thyrogen for our patients who are who've had thyroid cancer or who are currently undergoing thyroid cancer treatment and receiving iodine therapy.
All right, hi Nicole.
We also do what's called our in-basket, and we get patient advice requests from the patients asking anything, whereas to labs, to refills, to questions in regards to medication, so on and so forth.
I'm Elizabeth. I'm one of the diabetes educators, and there's two other educators that also work with our doctors, and we do anything from teaching people about how to inject insulin to talking to people about how to count carbohydrates to CGMs to pumps, basically any education around diabetes and nutrition. But as far as how we get involved in the care, it can be either, patient driven, they're reaching out to the educators, or also provider driven, they're reaching out to us to make sure that their patients get seen and get the care that they need. We see pediatric and adult patients, so in one day, I still remember my first day here, I saw someone who was 7 and I saw someone who was 77. Diabetes is can be totally different depending on the patient and their experience and what they have going on. So I think it's really interesting to be able to, even though it's the same diagnosis, that does not mean it's the same story for every patient.
Yes, I think we should teach him how to administer insulin.
Okay.
And we should encourage them to use the Libre too.
Okay.
Would you just start with the hyperglycemia correction or would you do some carb?
That's a really good question. I think it really depends on if they're on the tube feeds and what they're eating.
Or even how the tube feeds are being administered too.
Now I'm doing a fellowship in both adult and pediatric endocrinology, and my hope is to be able to care for patients and their endocrinopathies throughout their lifespan.
I've been supervising the fellows in their clinic probably for the last 10 years. It's a fantastic experience because first off, we actually see together a variety of patients. So I see the fellows starting from the first year, and getting more comfortable and getting to know better the field, and beginning maybe a little bit more hesitating, and see them often within the first year become much more comfortable in making a good assessment. But they are, they have a primary role in managing these patients. They have they give a lot of responsibilities, which I think is very important for the growth. And they also have a direct relationship with the patient. We have on one end the fellows clinic, where they have the direct relationship with the patient. These patients are fellows patients, and they have also the opportunity of rotating through the attending clinics, where they get exposed to different subspecialties, I would say, of endocrinology.
Typically, I'm here 6 half days a week. Hopefully that'll increase when things start to get a little bit safer. Sometimes I do cover fellow clinics, so I'll be helping them with their precepting for the fellow clinic too. But there's always med students. We do have rotating undergrad students that come pretty often too, so there's always opportunities to teach everybody from every level in medicine.
I've been at the University of Chicago going on 8 years now and did all my training here and have really loved the transition to faculty. It's a great group of colleagues and I love our patients and all of the great experiences we get to have. Most of what I see is either osteoporosis or diabetes. And I have a specific interest in diabetes and pregnancy, so I work with one of the maternal fetal medicine OBs, and we actually see pregnant diabetic patients together, which is a really cool new service that we're able to offer. We're lucky to be able to have many of our patients on continuous glucose monitors, so even if I'm not seeing them every week, I'm able to check in with them remotely on their blood sugars. And I actually have 2 patients in delivering today, so it's a fun day.